Good day, folks. Thank you for joining us here at Your Health. On today's program, we will be taking your calls for the entire hour. Please give us a call. I'd love to talk to you and make a difference in your health. First, let's go to our news. Let's see what's happening in the health world. Diabetes-related deaths are much more common than thought. Researchers from the University of Pennsylvania analyzed health data from the National Health and Nutrition Survey and the National Health Interview Survey. The total number of subjects exceeded 300,000. About 22,000 of the subjects provided blood samples for a more accurate estimate of total U.S. diabetes rates. The study found at least 12% of all deaths in America are diabetes-related. This is about 300% higher than estimated diabetes deaths in 1980. The study was published by PLOS One. Related research from Oregon State University finds those with metabolic syndrome or prediabetes require about 50% more vitamin E than healthy people. They also found the conventional test doctors use to assay vitamin E levels is grossly inaccurate. The study was published by the American Journal of Clinical Nutrition. Well, folks, this is worrisome. Our first study finds diabetes as the cause of far more American deaths than we've ever thought. The study used more reliable data to make their findings, so every indication tells us their conclusions are unfortunately true. They found 12% of all American deaths are actually due to diabetes. That's about 120,000 deaths every year, making diabetes the third leading cause of death after cardiovascular disease and cancer. And our second study reveals one of the reasons why diabetes is so deadly, and there are many. This study from Oregon finds those with metabolic syndrome, or prediabetes as it's often called, require about 50% more vitamin E in their daily diet or supplement plan than healthy people. Now, vitamin E is used to regulate gene expression and immune function. It initiates wound repair, including damage done to our blood vessels by atherosclerosis, and it's also important in vision, brain, and nerve function. It's estimated that some 95% of all Americans do not get enough vitamin E, and for the diabetic and pre-diabetic, vitamin E deficiency states are even worse, as their need is 50% higher. Now, from previous research, we know diabetics need up to 1,000% more of the B vitamin thiamine, and they also require about twice the amount of magnesium. Well, I think we're beginning to understand why diabetes is such a deadly disease. If not managed just right, it may cause great damage. On the positive side, another recent study from the CDC found our sugar-sweetened soda consumption has decreased by about 25% in the last 15 years. This trend alone will save millions from the ravages of diabetes. There are two new studies from the University of California, San Diego that underscore the importance of getting regular exercise. First, from a study of 47 subjects, researchers find just 20 to 30 minutes of brisk walking creates a systemic anti-inflammatory effect similar to taking an anti-inflammatory drug. And from a study of almost 1,500 senior women ages 64 to 94, researchers find senior women who sit for 10 or more hours a day have organ and body cells that function as though they are 8 years older than senior women who move about during the day. Well, we all know that regular exercise is an important part of a healthy lifestyle. And since scientists are intensely curious creatures, well, they want to know why exercise is so beneficial. And these two studies, the first published by Brain Behavior and Immunity and the second by the American Journal of Epidemiology, find two basic reasons why exercise promotes health. The first study found it calms inflammation. Now remember, inflammation is a basic driving force of many chronic diseases such as cardiovascular disease and cancer. And the second study finds sitting and sedentary behaviors in general make our cells age faster, which in turn leads to the chronic diseases that account for most of our top 10 causes of death. Safety concerns emerge for new hepatitis C drugs. Researchers from the Institute of Safe Medication Practices analyzed FDA database reports from doctors around the world. They found the new drugs that have been providing hope for hepatitis C patients come with a small but real risk of serious side effects. The study found the medications Sovaldi and Harvoni may cause liver failure, severe liver injury, and death. Previous reports had proclaimed the new hepatitis C drugs were completely safe and nearly 100% effective in removing all traces of the hepatitis C virus from patients' bodies. The study also found in some cases Sovaldi and Harvoni are actually ineffective. Well, folks, this is a very important study, and it is critical that everyone understands the facts. First, hepatitis C is a terrible and deadly condition, as it can lead to cirrhosis, liver failure, liver cancer, and death. Some 3.3 million Americans have it, and some 20,000 die from it every year. Hepatitis C is the #1 reason why a person would have a liver transplant, and until recently there was no cure. But then the drugs Sovaldi and Harvoni came on the scene. They were heralded as a true cure and a true wonder drug for those with hepatitis C, with miraculous near 100% cure rates and with no side effects. But now this independent study finds from FDA-provided data that these drugs do in fact carry a small but real risk of serious side effects. And I want to be perfectly clear on this one, so here are the actual numbers. Out of 250,000 users of these drugs, 524 had liver failure, 1,058 had severe liver injury, 165 died, and in 761 the drugs were completely ineffective. This means that for about 1%, and that's low, 1% of those who use these drugs, it leads to big problems, including death. But for the vast majority, 99% in fact, these drugs still represent hope and a true wonder drug. And that's a good thing, even if the medications cost over $1,000 a pill, for a total hepatitis C treatment cost of anywhere from $55,000 to $125,000. Wow, isn't that something? Now, this report should not stop anyone from appropriately using these medications, but it is important that you know the risk, and hence this report. Well, today on Your Health, we will be taking your calls for the entire hour, so join us. We'll be right back. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why Bioinnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings. I'm Cindy Becker, and this is Your Health at a Glance. Did you know the typical baby born in America today has over 200 foreign chemicals in their bloodstream? The world is a polluted place, but just how polluted may come as a surprise. Health experts report that pollution plays a major role in the development of ADHD, obesity, cardiovascular disease, Parkinson's disease, ALS, and a wide variety of cancers, including prostate and breast cancer. There are safe and simple steps you can take to lower your exposure to chemicals. Eat an organic, pesticide-free diet whenever possible. Be careful with the home use of chemicals. Don't consume fish that may be contaminated with mercury. Have your water supply tested for purity and add houseplants to lower indoor pollution levels. By taking a few basic steps, we can protect ourselves from disease-causing pollution. For Your Health at a Glance, I'm Cindy Becker.
There are thousands of fungal species, and at least 200 of them have been found to cause human diseases.
Fungal infections are common, so what can we do to protect ourselves?
One solution is oregano, a natural alternative. Oregano fights problems created by fungus and yeast overgrowth, and it improves many other health conditions.
At Bioinnovations, we offer oregano in gel caps and liquid extract.
Yeast and fungal disorders can improve.
So take charge of your health by choosing a natural alternative such as oregano gel caps or oil of oregano liquid extract. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. Welcome back, everyone. It's just great to be with you today, and today's show is going to be fantastic, and you know why? Today's show is all about you. We're going to be taking calls the entire hour, so please pick up that phone, dial 800-635-2673. Well, let's get right to it. Let's go to Florida now and welcome Gina to the show. Hi, Gina.
Hi, how you doing?
We're doing pretty good. How are you, Gina?
I'm doing fine.
How can we help you today?
Okay, a month ago, me and my husband are truck driver. We're team truck drivers, and I had very severe lower back pain. The longer I sit, the worse it gets. Yeah. 3 years ago, I was diagnosed with fibroid tumors. I had a procedure done to shrink the fibroids. So I don't know if did that cause me to have this very bad back pain or not. And even the heel of my foot is hurting, and the pain is really bad. I took x-rays the other day in the emergency room, and they couldn't find nothing wrong, but the pain is still there. I don't know if
it goes down to your foot, into your heel?
The heel of my foot was hurting without the backache, and then it went away, and then my lower back hurt.
Gina, could I ask you, how are your periods doing? Are you having them?
52 years old. That's why I couldn't believe that it's kind of heavy, because I'm anemic. And yeah.
Well, apparently your fibroids are still active and present. If you're having heavy periods, this is very typical of fibroids. Yes?
Yeah, they gave me a procedure, but it didn't. It shrank it down, but it's still there. They wanted to give me a hysterectomy, but I didn't want that.
Well, I can understand that. Well, let me give you a little basic knowledge on fibroids. Fibroids are almost always benign tissues that grow in the uterus, and they have hormonally responsive tissues in them, and so as the endometrium builds up, the fibroid will congest, and it can be very painful, and you can retain clots because the smooth lining of the uterus is altered now, and it inhibits the flow, the free flow, and there can be clotting, and the flow can be quite heavy sometimes, and this can lead to anemia, and it can be a real problem because when you are anemic, this eventually compromises your ability to clot and control blood flow, and so the periods can become so bad that women have actually hemorrhaged to death. And I'm not saying you're going to hemorrhage to death, but if in severe cases, it can get really bad, and to the point where women need to have a hysterectomy to stop the process. Well, that's all true, and hysterectomies are the most common female operation done in America, and many critics say we do too many of them. And I'm not making a comment on that. I'm sure we do. We probably do too many, but many women need a hysterectomy, and many women's lives are improved with a hysterectomy. Just having said that. Now, here's the thing about the fibroids. They are absolutely hormone dependent. And the reason we know that is if you can make it through menopause, where the hormone levels drop in the postmenopausal time, the fibroids shrink, and by the time you're 70, 80, they won't be there anymore. Because you could survey 1,000 elderly women and never see any remnant of a fibroid, maybe a scar, but that's it. Gina, did you get that?
Yeah.
They do go away with time, but you're already anemic and you're in pain. You may not be able to continue on. You know, you're on the road, and if you get too anemic and in the middle of menses, you could really get into a tough problem. You could faint at the wheel. Let's put it that way.
They got me on iron pills, and it helped out a lot. But I don't know if that's causing me to have the low back pain. This back pain.
Well, that's the next issue.
Yeah.
It is possible that you could have a fibroid growing in the posterior aspect of the uterus, and it's putting pressure on the pelvic bowl, and that could put a little pressure on the spine and refer some pain down the legs. But it's more likely that you have a disc problem or arthritis in your low spine that's inflaming the sciatic nerve, and that's referring pain down the leg. And that may not show on an X-ray. It would take a MRI or even a CT scan to see that. Did they just do an X-ray, Gina?
Yes, a few days ago I went to the emergency room, but they said they didn't see nothing, but they gave me some muscle relaxer, and I was scared to take it.
Yeah, you could get real drowsy driving a big truck. You don't want that kind of problem. Well, you know, one of the simple tests to rule out if you have a ruptured disc or pressure on the nerve is to sit on the floor with your feet out in front of you and try to touch your toes with your knees straight. You follow me? If you can go down and touch your toes and it doesn't cause extreme pain down the legs, about 80% of the time you don't have a ruptured disc. It's something else causing the problem. That's not a perfect test, but it's something anybody could do at home and get an idea. Do you have an idea if you did that, what would happen? Do you think it'd cause you great pain?
I don't know, because I've been driving for 6 years, and I had a fibroid tumor for years. So I don't know if I did something else or if this is arthritis. I don't know, but it's real bad. I cannot.
Well, I think you need to go to an expert. First thing I would do, I would go to the gynecologist to see the fibroid status. You could have a very large fibroid that's formed, that's putting pressure on sensitive tissues in the back of the pelvis and down into the legs. That's entirely possible. That's where I'd start. And if they say, no, your fibroids aren't that bad, then I'd go to either an orthopedic specialist or a neuro specialist to evaluate the back situation. Does that make sense to you, Gina?
Yes, it does.
You know, that's not the kind of thing that the emergency room is really good at doing. If you're hemorrhaging and on the edge of death, yes. If you're in a terrible car accident, truck accident, and yes, they'll help you there. You know, this type of thing, trauma and acute heart attacks. But for your type of problem, I would go another way. Now, I want to give you a little more advice, because if you can get through the menopausal years and decline the hormonal effects, the fibroids will begin to shrink. Now, I don't know if you have time for all that. Do you get my drift? I don't know if you can endure it long enough.
Yeah.
You may have to have the hysterectomy, but if you can, there's some things that will help with that process. And I would love to send them to you, because they won't interfere with whatever the doctors tell you you should do.
Okay.
First is our what we call our Healthy Balance for Her approach. It's a combination of herbs and dietary supplements that help to normalize the hormonal effects and ease us through menopause. It can be very helpful for you. First is the soy isoflavones. Just follow the instructions on the bottle.
Okay.
Soy isoflavones, flaxseed oil, all of this is coming to you. The diindolylmethane with sulforaphane, which is an extract from broccoli and cabbage, kale, that type, the cruciferous. It's an extract. It helps to modulate hormones. It improves your hormone regulation. Wild yam, and then I'd also like to send you a tube of progesterone cream. Half a teaspoon on thin skin, alter the site of rubbing. Do that every day except for the menstrual week. Okay? And I want you to start on vitamin D, 5,000 international units every day. That'd be 5 of the little capsules. And I want to send you the Active Adult Multiple Vitamin and Mineral. Now, this is a low iron. In fact, there's no iron in the Active Adult. And so you can't rely on that to support your iron-building efforts for the anemia. But one of the fundamental principles of vitamin therapy is never just give one vitamin at a time. And they've been doing that for you with the iron. Yes. You're trying to build blood. It takes more than just iron. It takes B12, B6, thiamine. There's a long list of things required. So this Active Adult Multiple Vitamin and Mineral Powder will help to support the proper production of blood. This will increase your chances of getting through this difficult time and keeping your uterus. But that remains to be seen. We have to go see the specialist. Do we have an agreement?
Yes.
Good.
Yes.
Any other questions before we go to the break? Because time is short.
Yes, I have a hypothyroid, but it's pretty under control.
Okay, that's
yes.
important because it's got to be good. Nothing works right if the thyroid is low. So get it up to the normal level, and you're doing that. That'll help to assure success. Thank you for your call,
Thank
Gina.
you so
Good
much.
luck.
Okay,
Bye-bye.
bye-bye.
Okay, we have a break. We'll be right back. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
I'm Dr. Richard Becker for Your Health at a Glance. More and more people suffer from asthma. One cause is obvious. The world is a polluted place, and the air we breathe is not always healthy. But other causes of asthma aren't as obvious. Recent research connects a poor quality, high sugar diet and the frequent use of antibiotics to higher rates of asthma and cases of asthma that are tougher to treat. A fast food diet does not meet our nutritional needs. Plus, the indiscriminate use of antibiotics can seriously disturb the delicate balance of healthy microbes in our intestinal tract. So switch to a garden fresh diet that calms and prevents asthma. Eat fruit-like veggies such as tomatoes, cucumbers, and eggplant. Eat yogurt, ginger, turmeric, and take fish oil. Nature holds the answer, but it's up to us to make healthy choices. For Your Health at a Glance, I'm Dr. Richard Becker. For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
BioInnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-2128. Ask about the AutoShip program for additional savings. Call today. We're back, everyone. Let's go to North Carolina now and welcome Jackie. Hi, Jackie.
Hi,
Hi, how are you today, Jackie?
I'm fine. How are you?
We're doing great. How can we help? How can we help today?
Okay, now I'm diabetic.
Okay.
And I've been diabetic for 30 years.
Type 1 diabetic?
Type 2.
Type 2, okay.
Yeah. Anyway, okay, it did good. I did well with my diet, and my sugar and everything was under control up until about 5 years ago.
Oh.
Yeah.
Hold it.
Okay.
What happened 5 years ago? Did you have dental work? Did you have a root canal? Something? What's going on?
What I did was the job that I worked in, I had to actually, I was working on a computer, and it started affecting my eyes. My diabetes did. And so...
were you under a lot of stress with this job?
Yes, I was.
Jackie, before you go on, I want you to be aware of something.
Okay.
You know, if we take a diabetic and we put them on a treadmill that is run by an electrical motor, okay, and we walk them, wouldn't you think it lowers their blood glucose? Exercise lowers it. But you know what actually happens? It raises their glucose. You know why?
Why?
Because a diabetic, when they're exposed to electromagnetic waves, it increases their glucose.
Oh.
Your constant exposure to computers, any electronic device that then they all create, anytime electricity flows, it creates an electromagnetic wave. And this is a relatively new thing to humans. We're not used to that just the last 100 years, and we certainly haven't adapted to that in that short amount of time. So what I'm saying is that you not only do you have the stress of that job, but exposure to electromagnetic waves will increase your glucose. And if your glucose goes up, you're going to begin to develop all the complications of diabetes. And before we go on, because there's more to this answer than just this. The one thing you can do that is simple, easy, and highly effective to cancel these electromagnetic waves is to ground yourself. And you can do this. You know the 3 plug prongs that it go into the wall?
Yes.
You know, the third prong, the top one, or I guess it'd be the bottom one, that's a grounding plug. That grounds. And we can access that and attach it to a skin, and you'll be grounded. Now, this is common in the electronics business. Also, every patient we take to surgery in hospitals and surgical centers, we ground all of them in there. And we do it to help with blood control, cautery, and we've learned over the years that grounded patients have fewer complications in surgery. And the electronics industry does it to prevent sparks, because just a spark will damage a circuit. Well, we can use that in your job to help you cancel the negative health effects of electromagnetic waves. So now most doctors don't know anything about this, but this is new and emerging, and it's been shown in multiple studies now to be of great benefit. So ground yourself. If you just search online for grounding, ground yourself. It'll help you when you're around electronics. Now, let's go to the next part. So your eyes are bothering you. Yes?
What began to happen was it started bleeding. Both eyes started bleeding. And they did surgery. Now, this was last August. He did surgery.
Did they do the laser in the retina?
Well, they did the laser 2 years ago. And this year, I switched doctors. And he didn't believe in the laser. So what he actually did was gave me a vacuum. Where they actually took the fluid out of my eye. Because it was bleeding, and gave me asbestin. After that. But that wasn't the question. The question was, after the first surgery, I've had 3 surgeries since last August. After the first surgery, they gave me a large dose of steroids, even though they knew I was diabetic. And that caused my blood sugar to jump high and low. And it did that for about 3 weeks after the surgery. And when I went back to my family doctor, my A1C had jumped from 6.6 to 8.7.
Yeah, the 6.6 is pretty good.
Yeah, it was. I had good control up until the surgery. And after the surgery, when it was jumping up and down, she said it went up to 8.7. And it kept affecting my eyes. Well, I started using the alpha-lipoic acid, the vitamin D, B complex, and my ears started ringing. And so my question was, what could I take that wouldn't affect the bleeding in the eye?
Because aspirin may affect the bleeding in the eye.
And I was taking a baby aspirin.
We can help you with that, dear. We can help you with that. You know, niacin in a B complex at 25 milligrams and up can cause ringing in the ears and a flushing sense. But it doesn't last long. If you stay at the 25 milligram dose, 50 milligram dose, and don't escalate the dose, a couple, 3 days, and then it's done. Aspirin helps to cut that, but you can't take that. Now, there's another thing you can do, niacinamide. Niacinamide is a form of niacin that does not cause the flush. But what I recommend you do, but the problem with niacinamide is it doesn't have some of the benefits than niacin does.
Yeah,
particularly the cholesterol-lowering benefits and possibly even benefits to the eye. So probably the best thing for you to do is to break that B-complex pill into pieces and slowly escalate your dose. And your body adapts, usually within 2 or 3 days, there's no more flush or tinnitus or ringing.
Okay.
Now, there's a couple other things I want to get in real quick because time is short.
Okay.
Things that will help your retina health. Lutein. These are pigments that the back of the eye needs. Bilberry. Carotenoids. I'm going to send you all of these.
Oh, okay.
We need zinc and vitamin E and fish oil, and I'm going to give that to you in the form of a high-quality multiple vitamin with fish oil. Then we've got the total retina health that will help you dramatically. And your story about steroids and diabetes, I want everybody to register to this. We have to be exceedingly careful with steroids. It can cause terribly high blood sugar levels. And now, Jean, Jackie's paying a high price for it.
Yeah.
We have a break. We'll be back, folks. Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
BioInnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Be sure to ask about the auto ship program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. Are you looking for a way to lower your risk of Alzheimer's? As the prevalence of obesity and metabolic syndrome continue to increase, researchers have found a possible link between type 2 diabetes and the onset of Alzheimer's disease. In fact, type 2 diabetics are at 200% higher risk of Alzheimer's compared to people without diabetes. These metabolic changes that develop with diabetes appears to greatly increase the speed of deterioration of the brain and other related systems. Lowering your blood glucose is easier than you may think. Eat smaller meals, exercise regularly, and reduce carbohydrates in your diet, especially simple sugars. Taking steps today to control your blood glucose may protect your entire body, including your brain. For Your Health at a Glance, I'm Dr. Richard Becker. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's Bionutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow. BioInnovations
is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. We're back. Let's go to Illinois now and welcome Irma to the show. Hi, Irma.
Hi.
Hi, Irma.
It's such a blessing to talk with you guys.
Oh,
Thank
it's
you
our
for
pleasure.
all you're doing.
Oh, well, thank you very much. I hope we can help you today, Irma. What's on your mind? What can we do to help?
Well, I have the pain in my left knee. Sometimes it swells up. And now, once in a while, I feel it in my hip.
Okay.
On the same side, on the left hip. Mm-hmm.
May I ask your age? It's relevant for this. How old are you?
I'm 70 years old.
You have a very young voice, young lady.
Thank
70? You sound like you're 40. Do you feel like you're 40, other than the knee, of course?
Well, sometimes I'm kind of tired.
Sometimes. Well,
I
you
feel
can get
pretty
tired.
good.
You can get tired at 40, right? Remember?
Yeah.
Okay. Did you ever injure your knee?
Yes, I did a couple of years ago.
Is that when this started?
Yeah, it did.
What happened?
Well, I went to the emergency room because I was outside when that happened.
Yes.
And they told me that there was no bone damage or anything, that it was like deep tissue damage, but it still bothers me.
Did you go in follow-up to an orthopedic specialist, a bone doctor?
No, I never did.
You just
do
went
that.
and you still have trouble 2 or 3 years later?
Yeah, once in a while, you know. It's not constant. It's just once in a while. Most of the time when I wake up in the morning, it's really stiff.
Yes.
You know.
Well, see, the importance of these questions, Irma, is we need to determine whether you have what we call an internal derangement of the knee, meaning a meniscus or a ligament or tendon is damaged, or is it arthritis of the knee? Because they have similarities, but you treat them differently. An internal derangement like a anterior cruciate ligament tear requires a surgical intervention, whereas osteoarthritis in the early stages does not. So it's important to have follow-up. Does that make sense to you?
Yes, it does.
Now, sometimes we can get an idea of what's going on by asking questions. You mentioned it swells sometimes.
Yes.
That can go either way, arthritis or internal derangement like a ligament tear, but it's really more like a ligament tear. Does the knee ever catch? Does it ever lock? So you can't move it? No, it doesn't do that.
No.
Do you have full range of motion with the knee? Can you bend it in all ways without undue pain? Now, it may be a little tender, but you can move it all ways.
Yes, it's a little tender sometimes, but it's not really a real bad pain.
Can you go up and down stairs without trouble, or just the ache? It doesn't lock up or cause a catch or a pop, a joint mouse we call it. Do you have a joint mouse that pops and clicks?
No.
Okay.
No.
Okay. Is the pain worse in the morning or in the evening?
It's worse when I wake up.
See,
in the morning.
Osteoarthritis. Do you have pain in any other joints?
Well, my hip right now.
Oh, you mentioned that. That's right.
Yeah, it bothers me sometimes.
Yes.
But it's not a real bad, you know. But I am aware of it.
Yes.
It's uncomfortable sometimes.
Well, I'll tell you what we can do. Let's treat you as though you have osteoarthritis because you are 70. You know, this is common, and arthritis commonly starts after an injury. You know, I'm still stuck on this. Can you tell me a little bit about how you injured it? Did you twist it? Did you fall on it? Did something strike you? How'd you injure it?
Well, I sort of twisted it a little bit.
Yeah.
You know,
see, that should be better.
At the time when it happened, you know, it was really a bad pain when it happened.
I can imagine.
I went to the emergency.
And it swelled up bad. Meniscus, you know, the cartilage between. You really should go get another opinion. It's a follow-up. It's not another opinion. Make an appointment with an orthopedic specialist and find out what's going on. Now, I'm going to treat you for knee pain. I'm going to give you dietary supplements and things that will help osteoarthritis and help pain in general. There's no reason we can't do this because the doctor can still make a proper diagnosis. We're not covering up anything. We're not masking anything. How's that sound? Does that sound like a good thing for you?
Yes, it does.
Yeah, let's do that. Let's do that. Let's get you started. Then the doctor can examine you and say, well, keep doing what you're doing. You're on the right plan. That's good. Or you have a problem inside the knee. We might be able to fix that for you with depending on what they find, right? I think that's a good idea. The first thing is glucosamine, chondroitin, and MSM. These are substances, and it needs to be crystalline glucosamine, and we'll send you that. That works the best. It nourishes the joints. It helps to provide a cushion in the joint, and it helps to calm inflammation in the joint. It takes 3 or 4, most people take 5 of these pills a day, and you can take them all at once. They're capsules, and they release well, they absorb well, and the crystalline glucosamine works the best. Next is fish oil. The omega-3s in fish oil help arthritis and inflammation in general. Take 2 of the gel caps a day, that's about 2 grams. Vitamin D. Everyone in America should be on vitamin D. You should be taking about 4,000 units of vitamin D a day. Then when you go in to see the doctor, say, hey, check my vitamin D level, because I want it to be around 50 to 60. They'll know what you're talking about. Most doctors are checking vitamin D levels now, and I want you to have a good level. You know, your whole problem of delayed healing could be because you're low in vitamin D. You live in Illinois. You don't get a lot of sun in the summer, a lot of sun in the winter. You get a lot in the summer, but unless you're sunbathing, you're not getting enough. Everyone needs vitamin D. Next, probiotics. They help to calm inflammation by taking healthy organisms for the intestinal tract. Boswellia, which is the biblical frankincense. It's great for arthritis and inflammation. A little noni juice, 2 or 3 ounces every day. It really helps. Now, it may help you to avoid wheat, rye, and nightshade, which is potatoes, tomatoes, and peppers in your diet, because they're known to aggravate arthritis. Wheat, rye, and the nightshade plants. Get an appointment with the orthopod. Let's find out what's really going on inside. Do we have an agreement?
Yes, we do.
All right, good luck. I hope this helps you. I'm going to send you Foundations for Healing as well, so you can read about arthritis and other musculoskeletal problems and how to deal with them. We'll be right back.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid, so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. Is our hope for you today. I'm Cindy Becker. In the epic movie Gone with the Wind, Scarlett O'Hara says she won't think about her problems today or she'll go crazy. She'll think about them tomorrow. How should we think about tomorrow in our lives? In Matthew 6, verse 33, we get advice about tomorrow. Seek first his kingdom and his righteousness, and all these things will be given to you as well. Therefore, do not worry about tomorrow, for tomorrow will worry about itself. It's so difficult to not worry about the future. Many of us catastrophize about the future. That's spending all your time thinking about all the catastrophes that might happen. So let tomorrow worry about itself. That way, we won't miss the wonderful things happening in our lives right now. I'm Cindy Becker. This is our hope for you today.
For thousands of years, Eastern health practitioners have used mushrooms for a variety of treatments.
And recently, scientists everywhere in the world have turned to mushrooms in search of health-promoting compounds.
These are known as medicinal mushrooms. Among some of the most potent are ABM, maitake, reishi, shiitake, and cordyceps sinensis.
At Bioinnovations, we've made available 4 of the most powerful mushrooms in one easy-to-use formula. We call it the Mushroom Complex. We also offer the amazing mushroom Cordyceps sinensis in a standalone formula.
Cordyceps helps boost energy, an amazing discovery now used in both Eastern and Western medicine. So take advantage of thousands of years of health knowledge.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. We're back. Let's go to Kentucky now and welcome Teresa. Hi, Teresa.
Hi, Cindy. Hi, Dr. Becker.
Hi, how are you today, Teresa?
I'm okay. I'm having some problems. I'm hoping maybe you guys can help me out.
I will certainly try. What's on your mind?
Well, actually, I think I've got some kind of hormonal imbalance going on that's just progressed, and it's kind of, I think, between kind of a triangle between obesity and some menstrual dysfunction going on, and now I think it's presenting in the thyroid. I just had some thyroid tests.
What did they show?
He said my TSH was 3.03, which is not that bad. But
No, that's not too bad.
My T4 was 8.3. My free T4 was 1.1. He only did the free T3, which
Are you on thyroid replacement?
I haven't been, and I just got an appointment with an endocrinologist, but it's going to be like another month before I can go.
Because did you say your T4 is 8?
It was 8.3, and the free T4 was 1.1. And
okay. What else? What else is going on?
The free T3 was 2.8, and the uptake was 30. And now my triglycerides are high, and they've never been. They're like 153, and they usually are in the 70s.
Yeah, 153 that's not elevated. That's in the normal range. That's okay.
And my A1C is 6.3, and I was treated for diabetes for years, and I had a bariatric sleeve surgery back in 2010.
You had a bariatric surgery?
Yeah, bariatric sleeve. That's where they removed most of the
Yes, I'm familiar. Did it work? Is it working?
I lost 140 pounds over 2 years, and then I took a job at a preschool and started having strep. I had strep 19 times over 4
Is
days.
the weight still off?
No, 3 years ago, that's when kind of all this hit with the thyroid. I gained 37 pounds in 2.5 months and started having the thyroid symptoms.
Yeah, but you were on antibiotics.
For over 4.5 years, 19 times, I would have oral.
Holy, my
strep.
goodness.
And
that's too much. We need to figure this out, girl.
yeah, it's been rough.
Okay,
It's getting worse.
Stop. Now's when you listen.
Okay, okay.
There are a lot of kids in the daycare center, and here are the facts. If there's 7 kids present, one of them's going to be sick. If there's 30 kids present, one of them's going to have strep throat, and you just don't know it yet. And if there are 100 kids present, there's at least one carrier who never gets sick with strep, but always has it and sheds it. Did you get that?
Yeah.
That means you're going to be constantly exposed to strep. That's one set of problems. Now, all bariatric surgeries, all surgeries that end in weight loss, compromise digestion and nutrient absorption, even the sleeve. Now, with the sleeve, they are not rerouting the intestinal tract. They're not cutting out part of the stomach, you know, so you have less absorption problems, but you're on, it creates a stomach that can't hold much food. And if there's not much food, you're going to lose a lot of weight, which is what you want, but you're also not getting the nutrition you need. What's happening to you, most likely, is you've developed a mineral and particularly a zinc deficiency. Then you get strep. When you're low in zinc, you get staph and strep. These are very similar gram-positive organisms, and you have low zinc leads to both of these infections over and over and over and over again. Now you've had antibiotics, so now your intestinal tract is dysbiotic. It's all jumbled up, and there's probably diarrhea off and on, constipation, you have bloating, you've gained 30-some pounds, and this is a direct result of all the antibiotics treated for strep. Now, strep is a serious infection. It's not a cold, folks, and when you have strep, most people need to take an antibiotic. Some people have a remarkably strong immune system, and they're immune to everything, and they don't need that, but if you do not treat the strep, it leads to damage to the heart valves, rheumatic heart disease. It can lead to arthritis and joint infections, lead to pneumonia. It can be life-threatening. It's just bad stuff. It's terrible germ. Family practice, we saw more strep. If I never see another case of strep in my life, I will be fine.
Me too.
Hundreds of cases of strep, and I've had it a bunch of times myself because, you know, the doctor's exposed all the time. So here's what you need to do. You know, you might consider changing jobs for a while. Your life is at risk, dear.
I quit.
Oh, good for you.
It's been almost a year now.
Yeah, but we need to get you straightened out. I want to send you Foundations for Healing. Read the whole thing. Learn how to treat dysbiosis.
Okay.
Treat dysbiosis. Critical agents for you. I'm going to send you zinc. Zinc. We've got to build your zinc levels up.
I actually tested to be negative in zinc right after my surgery and took replacement for a few months.
Oh, well, you need more.
Okay.
You need more. Remember, your sleeve is still present, right?
Right.
Okay, you're still, you always need to be on vitamins and minerals for the rest of your life as long as that sleeve is in you.
Right.
Okay, zinc, at least 25 milligrams a day, preferably 50. IP6 and inositol, we need to improve the immune response. Medicinal, we're giving you natural antibiotics that will help you kill strep, but without the bowel flora disruption. Probiotics, eat yogurt every day, every meal, and take probiotic tablets, capsules. Ours is a little tablet that dissolves very nicely with every single meal.
I tried taking probiotics after every course of antibiotics that I ran, and a few times it really did good, and I could really tell a difference. And then
Try mine. Honey, time is short. I'm sorry. I don't mean to cut you off, but I have to help you, and that comes with me talking.
Okay, I'm sorry.
Try mine. It's completely different.
Okay.
You're going to be amazed, and get different types of yogurt and have them with every meal. We have to do this. We have to restore everything. And oil of oregano. Absolutely wonderful natural antibiotic, and a quality multiple vitamin. Active Adult would be the good one, I think. You can use any of our multiple vitamin minerals and powder, but Active Adult would be very good. Now, the next thing you need to do is treat the vestibule of your nose. What happens is we can eliminate the strep in our tonsils, in our throat, in our skin, but the hairs of the nose retain the organism, and it doesn't get killed with the antibiotic, systemic antibiotic. So take a little Neosporin, put it on your little finger, and put it in the vestibule of your nose. The vestibule of the nose is where you can put your finger, where the hair grows. That's the key. That's where the germ is being harbored. And if there's anybody else in the family who never gets sick from you, they need to be treated, because they're probably carriers and you're getting it back from them. Okay? Treat the dysbiosis, recolonize the gut, restore the minerals, kill the bad bacteria, replace it with healthy ones, and you should start feeling better. I'm sorry, I know there's more issues that you would like to talk about, but our time is up. We'll be back for our wrap-up in just a minute. CoQ10 and L-carnitine are among the most important nutrients our bodies use for energy production. Deficiency in these key nutrients can cause serious complications to your health. In fact, statin drugs that are used to lower cholesterol may deplete your CoQ10 levels.
BioInnovations brings you Dr. Becker's Bionutrients CoQ10 with L-carnitine. Now, providing support for cardiovascular health is easier than ever before.
CoQ10 and L-carnitine support a healthy heart naturally, as nature intended, and our formulation provides 300% greater absorption of CoQ10 than similar products, using a technology so effective it's patented.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. I'm Cindy Becker for Your Health at a Glance. Do you like to exercise outdoors? Many consider gardening one of life's most rewarding activities. The American Heart Association says gardening promotes a strong heart, and it helps to preserve brain mass in seniors. Follow these guidelines so your gardening experience will be enjoyable for years to come. Wear a wide-brimmed hat and protect your skin from too much sun. Wear gloves and sunglasses even on cloudy days. Make your posture strong by bending from the knees. Consider wearing knee pads. Start with small jobs. Set a gentle pace and ask for help when moving heavy objects. Pause frequently and drink lots of water. Whether it's trimming bushes, cutting grass, or growing nutritious vegetables, gardening is a great way to get your exercise and get back to the earth. For Your Health at a Glance, I'm Cindy Becker.
Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers 2 products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Go online at bioinnovations.net or call 888-442-2128. Ask about the AutoShip program for additional savings. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back. We've had several callers over the last several weeks who have an interest in knowing more about how to diagnose Lyme disease. You know, this tick-borne illness that is becoming so widespread across the country. And it originally started in Connecticut in the northeastern seaboard. Now we know that you can get Lyme disease in virtually all the states. If you know the deep woods are the most likely place, deer tick transmits this. And the nature of this germ is one that it invades into cells and it hides from the immune system. So it's so effective in hiding from the immune system that just looking for an antibody is only antibody to the germ. You know, when you're fighting an infection, antibodies rise, and these antibodies are an indicator that you're fighting a germ. And just looking for those antibodies to Lyme disease is not good enough. Half the time you're going to miss it because the germ can hide. And it's a real dilemma. So they've invented several things. The classic test is the Western blot, the ELISA, PCR polymerase chain reaction. What this is they take an antigen, and in this case it's DNA, a substance, and they amplify the content. This is how the crime scene guys check for DNA. You know, a couple cells, they amplify the DNA content so they can classify who it is. What is it? Well, they do the same thing to the Lyme germ. They will take and amplify the DNA so they can detect it. That's helping a lot. LTT Melissa is a new one that's coming on the scene. These are all, each one gets a little better in detecting Lyme disease. But still, the bottom line in Lyme disease, if your symptoms suggest Lyme disease, you better treat it. Because half the time there's no bullet, the target rash, the bullseye rash that appears, half the time you don't have it. Half the time people don't remember having a tick bite. They have no idea is this happening. I just feel bad, I feel terrible, headaches and joint pains, and I'm tired all the time. If the symptoms suggest, if it's possible, treat it. Now, I think it's important to see someone who has experience in diagnosing and treating Lyme disease. That's important. Also, Dr. Lee Cowden, MD, has a natural protocol for the treatment of Lyme. You can look it up online. It's difficult, it's complicated, but it's a natural approach to treating Lyme disease. You can do it on your own, which is quite nice to have that available if it applies to you. Lyme disease is tough. If you think you have it, find an expert, treat it, and be done with it. It's tough stuff. Well, Cindy, fascinating calls today. I hope we helped you with your health concerns. We'll see you tomorrow, folks.
Thanks, everyone. Bye-bye.
Did you know not all bacteria is bad? Probiotics are healthy, beneficial bacteria which provide life-giving support for your intestines. Add foods like fermented cabbage, coconut, or miso that supports the good bacterial balance in your gut. Real foods like this boost your nutrient assimilation, plus you'll feel great. It's not crazy, just healthy.
Next time on The 3 is part 2 of my interview with Dr. Robert Jeffress. And this time, we've dedicated the entire show to discussing his work as a faith advisor for President Donald Trump.
And I said to him, Mr. Trump, I believe you're going to be the next president of the United States. And if that happens, it's because